Fibroids are benign tumors that occur in the uterus, and unfortunately 80% of women in the Caribbean are predisposed to the condition by simple genetic makeup, that is, of any woman of African descent. The statistics shared with our news by Interventional Radiologist at Family Medicine Center, Dr. Mikhail Higgins, who says women diagnosed usually present with some of the following symptoms.
One is menorrhagia, sort of lifestyle limiting, which is essentially heavy bleeding. So if you sort of imagine a period where a woman would sort of maybe use a pad or 2 pads in a 24-hour period, these women are using 5, 6 pads. These women are essentially calling off for work because sort of the heaviness of their period. And if you think about blood sort of obviously carrying oxygen to tissues, they're losing that. And so these women have lightheadedness, some women faint, other women have issues where they have such low energy where they're not even able to sort of engage in exercise and fitness-related activities.
Dr. Higgins says other major symptoms include bloating, constipation, a constant urge to urinate, and pain during intimacy. He says these symptoms can present as early as age 15, but appear predominantly in women between the ages of 30 and 50.
It's really after a woman sort of develops symptoms that her provider would then sort of be prompted to then sort of provide the appropriate diagnostic test, which is usually an ultrasound.
To minimize these symptoms, Dr. Higgins says you should avoid acidic foods that promote inflammation and rapid cell turnover.
The converse of that would be an alkaline environment that really promotes an anti-inflammatory environment. So there are foods, certainly, and certain diets and that many nutritionists are very familiar with that would sort of kind of be within that category that would discourage certainly tumor growth. And so one of the things that's very important for women is to really consider sort of detox.
And while fibroids are not a preventable disease, there are treatment options, including a new minimally invasive surgery, a specialty of Dr. Higgins, who is encouraging women to pay attention to changes in their bodies. Reporting for Our News, I'm Megan Shepard.